does glycine break a fast?
I ran into this personally in February. In February, I was in the hospital.
Is it safe if you're on blood thinners?
Oh, okay, yeah, that's a good point.
And is that L-glycine on the supplement shelf a sign the brand doesn't know what they're talking about?
This is from some of those people who don't know anything about glycine biochemistry, right?
Today, biochemist Dr. Joel Brind is answering the questions you've been sending me for months. We're covering why kidney patients get a false lab result from it, whether it breaks a fast, why your magnesium glycinate might be 86% something else entirely, and what happened when Dr. Brind put himself on 40 grams a day for almost 2 decades. So if you're taking glycine or if you're on the fence about starting to take glycine, stay with me because some of those burning questions you have in your mind are about to be answered. So let's go. This is the question that I get. I mean, not over and over, because it is a small percentage of people who respond this way. But I have heard, I take glycine, I get excited. It's actually stimulatory, and it made my sleep worse. So Dr. Brind, what is going on here?
Everybody's different, especially when it comes to the nervous system, because everybody's brain and central nervous system is different, because the brain and the central nervous system actually change. The cellular connections actually change with every moment of experience. So now there's a neuronal connection about nitrous oxide that wasn't there before. Because you mentioned it. Everybody's nervous system is a little different, and there are all kinds of counterintuitive reactions that happen. I know my mother, for example, whenever she was given something like she didn't have depression, but when she had like I know when my father passed away and she was very upset, the doctor gave her some Valium. It was new at the time, you know. I guess that's an antidepressant, right? So, and it made her all wired. No, it was the dentist. It was, have some Valium, and it just made her wired and excited. So remember, glycine, it affects excitatory neurons, inhibitory neurons through the 2 different kinds of receptors. And, with different people wired in different ways, it will do that to some people. Its effect on inflammation, for example, that's the same with everybody. That's really uniform across the board. But the nervous system is not. That's why now there are these miracle drugs for bipolar disorder, for schizophrenia, which if they're balanced right, they can actually render people's brain normally functioning or very close to it. And you'd think, well, why isn't it just, hey, I have this problem, I take this pill, there's the cure, it's done? No, it takes a lot of skill and art. There's a lot of the art to the medicine of psychiatry in balancing the medications and trying this one and that one. A lot of it's trial and error to see what all these different related antipsychotics, antidepressants, all these different kinds of things, they all have different effects because they all affect different receptors on different types of neurons to different degrees. That's just the way it is. So glycine is a neurotransmitter. In addition to everything else, one of its major roles in the body is that it is a neurotransmitter. So if it affects people that way and they still glycine short, I say don't avoid glycine. You may avoid free glycine. So for example, sweetamine is glycine powder. Maybe it's not good for you to take it very quickly because it's straight glycine powder. When you eat it, it just gets absorbed right away. It doesn't need to be digested. But bone broth does, gelatin does, collagen peptides do. And so I say get your glycine from collagen, get it from gelatin. There are lots of places you can get that, right? They can get bone broth and collagen and all that stuff. They can get it from Paleo Valley, right? They can. Yes. But get it that way. Don't get it from sweetamine or a straight glycine supplement if you are sensitive to it. You still need it, but don't take it in a form in which it is absorbed so rapidly.
Yeah.
I don't sell it, but you can get it from someone else who does, like the lovely Autumn Smith from Paleo Valley. Be happy to sell you some bone broth, even chocolate bone broth.
That's right. Even bone broth for people who don't like bone broth that you can actually put in your coffee. So would you say, so for people who got like anxiety or whose sleep it would negatively impact, maybe they could try it during the day too, right? Like, but also if you get a migraine, obviously go to the
Well, if it produced an effect at night which was desirable during the day and you needed that, you could do it. What I'm saying is that it sounds like some people are just so sensitive to it that they might want to avoid taking it in one shot at any time. But you can experiment with it because it's safe to do that. It's not going to hurt you.
I love that. And then that goes for people with digestive issues too. I've seen that too. Or,
Yeah,
oh, I've
yes,
got,
right.
yeah, so just use the food-based versions. Okay, another one is L-glycine the most bioavailable form? We've talked about this, but bust this myth and answer the question for us,
Yeah,
Dr.
this is from some of those people who don't know anything about glycine biochemistry, right? The people who don't know anything about glycine biochemistry are the ones that sell you L-glycine. Those are the people who don't know what they're talking about.
Yeah.
Because you know amino acids are either the L, the left-handed form, or the D form, dextro, the right-handed form, right? They're the mirror images of each other and they're not identical. Complex chemicals, like biochemicals generally, they have handedness. So if you take the chemical structure and you hold it up in a mirror, the mirror image is not the same compound, right? Your left hand and your right hand are not identical. One is right-handed or one is left-handed, right? Your thumb is on one side of one hand and on the other side of the other hand. So that's the way it is with amino acids and other biochemicals, but glycine is not. It's so simple that it is non-chiral, which means its mirror image is identical to itself. Its two mirror images are identical. So there is no D or L-glycine. Glycine is just glycine. And so if they sell you L-glycine, that's called biochemical ignorance. Very much on display in big print on the label. It's funny to see L-glycine.
Perfect. And what about people with kidney disease? They're wondering, I have kidney disease.
Oh, okay, yeah, that's a good point. If you have kidney disease or you're being tracked by your doctor because you have kidney problems or you might have kidney disease, then I would say avoid taking a glycine supplement for about 3 days before you have a blood test. The reason is this. Glycine is actually protective for the kidneys. It's actually good for the kidneys. However, it raises the concentration of urea in the blood because it is the main precursor for the first step in the urea cycle. Urea is broken down by an enzyme called carbamoyl phosphate synthase, or synthetase, CPS. So CPS is the first step in the urea cycle. It usually gets the ammonia group from glycine, takes the amino group off of glycine. Doing that, it actually will accelerate the production of urea. One of the measurements in a regular comprehensive metabolic panel that they will do in a blood test is they will look at urea. They'll call it the BUN, the blood urea nitrogen. How much urea is in your blood? Well, because glycine also will help you make more creatine and more creatinine in the blood. That way, your BUN will probably be high. My BUN is abnormally high, somewhat, but not enough to alarm the doctors, but it's outside the normal range usually, depending on when I've taken my glycine. And the reason is that glycine is converted, or part of it is converted into urea. And the algorithm they use to assess kidney function incorporates how much urea you have and how much creatinine you have. So both urea and creatinine are made from glycine. And because it increases those, it makes it look like your kidney function has been, what's the word I'm looking for?
Altered. You're suppressed.
Or so it looks like, your kidneys are not working that well because your BUN or your BUN to creatinine ratio is too high. But that's just what we call an artifact. It's an artifact due to the fact that you're taking glycine supplements. If that's the case, you let them do the test without any glycine, without any supplemental glycine, and just give it 3 days to clear out completely if you are taking glycine supplements before you have a blood test. That'll also tell you whether the glycine's working or not for inflammation. Your aches and pains may come back,
Perfect solution.
Inflammation may go up again. But for the sake of the test and how it's interpreted, that's important. But it does not negatively impact kidney function. In fact, quite the opposite. Some of the earliest research done by the Thurman group at UNC shows that it's actually nephroprotective. It can protect the kidneys from known damaging agents to give them glycine. Interestingly enough, a little corollary to that story about CPS, the enzyme that actually is the first step in the urea cycle. That's how that group at the Cleveland Clinic found out that glycine lowers the risk of heart disease, because they did a study where they went through their archives where they have like hundreds of thousands of blood test results on file, and they also have genetic profiles, and they have people who were known to have genetic defects. So they had people who had carbamoyl phosphate deficiency, inborn inborn metabolic error. They have a genetic mutation in CPS, so they don't make urea as efficiently. So their urea levels are low in their blood, and guess what's high in their blood? Glycine, right? The pathway backs up a little, so the glycine doesn't get cleared as rapidly. And guess what they found? They found that women, men, I guess, kidneys are masculinized, they're a little bit different. But in men, it made no difference. But in women who had this deficiency, they had a very, very significant 12% reduction in major adverse cardiac events. And they knew that it was the glycine. They statistically tried for everything. What's doing it? What's doing it? We adjusted for this, we adjusted for that, we adjusted for everything else. We adjust for glycine level, and wait a minute. Now the protective effect is gone.
Wow.
That means that's what's responsible for the effect. So this is, his name is Stanley Hazen, is the principal author of that study. He's also the principal author of the study that raised undue alarm about erythritol. It's like they should have known from that study that glycine will actually lower the risk of major adverse cardiac events. Again, not talking about a drug effect or medical advice or anything like that. This is just something that was found by this Cleveland Clinic group. So again, more evidence. That's how my whole journey through this, starting in about 2007 and ending in about 2010 when I was finally convinced that the pieces of the jigsaw puzzle were pretty much put together. Every sort of odd finding from a different branch of science, whether it's the cancer thing or neurological thing or the sleep or anything else, all roads pointed to glycine. And again, some of the naysayers who would raise the myth that say, oh, glycine can't do all those things. It's not good for so many things. That's too simple. And you find this among scientists too, where they say, oh, well, this is complex. Scientists use that a lot. They say, well, that's complex, which is another way of saying I don't know what I'm talking about. But if I say it's complex, I'll sound more like an expert, It's complex. Oh, it's beyond your understanding, when they really mean it's beyond my own understanding. I don't know what I'm talking about. But what they're saying is it can't be that simple. It can't be that one compound that does so many different things that's so key and so important. And because that sounds unscientific, it sounds too simplistic. But actually, the scientific principle is called Occam's razor, which is it's the simple answer that's going to be the right one.
Yeah.
Don't reject a hypothesis because it's too simple. You reject a hypothesis because it's too complicated. That's why we all believe that the planets revolve in nice elliptical orbits around the sun, and not that the sun and the planets revolve in complex epicycles around the Earth, because that's too complicated. So we went with the Copernican model instead of the Ptolemaic model.
And look at us now.
The silent P, by the way, in Ptolemaic.
I love that. I love that analogy. And then a few other questions too. If you have no gallbladder, is glycine safe?
I can't imagine why it wouldn't be, because the gallbladder has to do with digestion of fats. And when we're talking about glycine, we're talking about no need for digestion at all. Or if you take, and even if you take, I don't think it would be a problem with gelatin, because there's no fat in it. I can't imagine any connection.
Okay.
Whereby that would be.
What about blood thinners like Eliquis or Warfarin?
Yeah, right.
People are on blood thinners. Should they be taking glycine or maybe sticking to
Well,
both?
that's an interesting question. I would say it's good to take glycine anyway. Theoretically, you might say, why should you need blood thinners if glycine works that way, if it's your body's natural blood thinner, right? Another way to describe it. Well, that may be, but you can't, first of all, I can't give medical advice. And now we're talking about drugs, very powerful drugs. And even aspirin, I would include under very powerful anticoagulation drugs. Because if you take these drugs, will make you bleed more. But glycine is much, much milder in that regard. It will basically restore like a normal function to platelets. Now, it is dose dependent. If you raise your glycine, like 100 times, it should, make your blood less coagulable. However, in these studies that I talked about from the urologic surgery literature, where people got glycine levels 100 times normal, nobody got a bleeding problem from it. So it's kind of a lot. You'd have to really raise your glycine levels like crazy, and you still wouldn't approach the kind of pharmacological levels that you get with something like aspirin. I mean, aspirin is so potent. You take one aspirin pill, because they showed, White, that if you take 30 grams of erythritol, you can still measure its effect on platelet aggregation the next day. You take one aspirin tablet, you can still measure its effect on platelet aggregation the next week. That's that's how potent something as simple and over the counter as aspirin is in terms of platelet aggregation. Glycine is good because it doesn't just act on the platelets by reducing their aggregability. It also reduces the platelet production of a coagulation factor called Pi1, which is really it makes the blood more coagulable by inhibiting the anticoagulation effect of the enzyme plasminogen. And it also, glycine also, by decreasing inflammation, decreases the production of, I think it's factor 2, one of the ones that are made by the liver, 2, 7, 9, or 10. But it has at least 3 ways that it actually makes the blood less coagulable, that is to say, not hypercoagulable. It normalizes it. So I really wouldn't worry about it. When you take something that it's not a medication, it's a food product, right? It's a nutrient, but it can have effects when you are taking drugs. It can affect those drugs. So if you have any question about whether medication you're taking is going to be affected by glycine, you really have to ask your doctor. And I'm not your doctor. I'm not anybody's doctor. I'm just a scientist.
Yep.
So,
And a safe way too, again, speaking to your doctor, take food-based versions. So you know what I mean? Add glycine in via your food could be another way to just supplement that. If you speak with
yeah. I mean, if you have too much, what are you going to have? Too much gelatin out of too much Jello?
I know.
I mean,
I'm just saying.
again, when you're talking about a food like glycine, it's so safe. You can take monstrous amounts, and they're not going to do you any harm. So that being said, if you are taking a strong medication, then there can be some interactions. I think there are some interactions reported with 1 or 2 antipsychotics. It can reduce the efficacy of clozapine or something like that. One of the antipsychotics can be reduced in efficacy if you take a glycine supplement. So it will not, affect normal physiology. It's not going to do you any harm, but it could interact with medication. And
Yes.
so indirectly, but the guy who prescribes you medication or the gal who prescribes you medication, he or she is the one you need to talk to about that, not me.
So true, and such funny timing because I read that trial this morning where I think it was in schizophrenics where they used that drug and they did not see an improvement in those negative symptoms like they had in other trials, and they did see what appeared to be maybe a worsening, like you're saying. So yes, all of that.
So it decreased the effectiveness of one of the antipsychotic drugs. Yeah, you can find that on WebMD. That's actually well known for some time.
Yeah.
But again, drug interaction is not. When I say I take it, sure, it's safe, it's wonderful, yeah, but drug interactions, you always have to talk to your physician if you're going to do anything. And hopefully you can find a physician who is not just, don't take any supplements,
Yes.
That's simplistic, What do you mean? The supplement could be anything.
Okay, few more questions. Mast cell activation syndrome and autoimmune disease. I know people often wonder, is glycine going to potentially help?
I don't know. It might. I really haven't seen any data on it. And I understand how people with MCAS are very loath to try anything because, it's like they have their immune system where their mast cells will produce histamine. They'll go off on a hair trigger, and all of a sudden they're in anaphylactic shock. They need to have their EpiPen at the ready at all times. It's hard to say. I have not seen a lot of research on glycine in that context. I will say that because of the lineage of mast cells being along the line of some of these white blood cells, they probably have glycine receptors and it would probably inhibit their activation. Theoretically, I might think it would be useful, but I would never recommend you take it. That's the kind of thing, because it's such a dangerous syndrome because, if you have an allergic attack, it can actually kill you very quickly. That's why you have EpiPens, things like that. I'm loath to recommend it or anything, but again, recommending it in the context of a particular medical condition that's like medical advice. And I would give you the basic science of it if I knew of any, good research on it, but I really don't. I have looked, but.
Yeah, haven't found anything. People are wondering too about chronic Lyme and autoimmune disease. I'd imagine you'd say the same thing. If glycine deficiency is an issue, and maybe with autoimmune disease, there's a lot of collateral inflammation.
Yeah, collateral inflammation, yes. So, for example, from systemic lupus erythematosus, right, lupus, rheumatoid arthritis, shingles, other diseases, shingles for sure. I mean, that surprised me when I had that finding.
Yeah.
That I had a classic case of shingles except for one thing, no pain. And I've had that. Other customers have reported that also. That seems to be a very consistent finding, and I'm finding that like with poison ivy rash, with gout, It's not autoimmune, but anything, and cystic fibrosis now. I gave it to a friend who has two kids with cystic fibrosis and said, try this glycine, try it. But I think her doctors, was, told her not to do any supplements, and that's too bad. But papers have been coming out. With cystic fibrosis is even more interesting. Not only is the problem that leads to life-threatening complications, like breathing, difficulty breathing, is secondary inflammation in the lungs, and glycine helps a lot, is the fact that the genetic defect in cystic fibrosis is another chloride channel, which is defective, so it doesn't allow enough chloride into cells, which leads me to the hypothesis that it could also help cystic fibrosis by providing some redundancy, by covering for this defective chloride channel by maximally saturating the glycine-gated chloride channels. And in this case, if that were true, and I can't do a clinical trial on this, but if that were true, it might be that cystic fibrosis is not really a genetic disease, but a genetic variant that only shows up as a disease in the context of glycine deficiency.
Interesting.
That's an interesting way to look at it. And it might be true, it might not be true. Again, that's a hypothesis that I have no way of testing, but I get it out there, put it out there.
I love it. What about people with oxalate issues? Is glycine going to be a...
Yeah, people have raised that issue because glycine can be turned into oxalic acid. There's a kynurenate pathway. I don't remember the details of that pathway, but usually it's not. But in some people, they may have the particular genetics that it may exacerbate the formation of kidney stones. So people who are prone to that, again, that's another genetic variant issue. And that might be a problem in the context of glycine surplus.
Yep.
Certainly if you take too much of it. So again, you're going to get glycine, you're going to eat glycine, and you need it, and your body doesn't make enough. But these other conditions will complicate the art of supplementing with it safely.
What about, does glycine break a fast?
Oh, good question. Well, I ran into this personally in February. In February, I was in the hospital because I had a hernia that needed repair. So they had me, I was on the equivalent of a 4-day complete fast because they had this stomach tube in there. They had to pump all the moisture out of my stomach. They had a continuous stomach pump. And they were giving me fluids intravenously because they had to dry out my digestive system so that they had room to make those little cuts and put in the robotic hand on one side and the robotic hand on the other side and the camera in the middle to be able to see what they were doing and do the operation, because the hernia got what's called incarcerated, so it actually needed to do a resection on a little bit of my small intestine. I couldn't have anything. They didn't even want me to have any fluids. So they made an exception. They said in order to take medication, I could have, a little bit of fluid. So I had my wife sneak me some Sweetamine.
And what'd you find out?
The doctor didn't know, but if truth be told, it's kind of breaking it fast.
Yeah, right?
But I didn't want to go 3 days or 4 days without any. I didn't have a full complement of it. I had a little 1 or 2 days in the middle there, so I never ran out of Sweetamine, so my glycine levels didn't get too low. But things can get, when you're on a 3 or 4 day fast, if you're on medication, different things. Like I was on medication also that can lower calcium, and so my calcium actually got critically low, which was a lot of fun. They woke me up in the middle of the night. Your calcium is critically low. Oh, great. I'll take a Tums. Oh, no, we have to report this to the doctor on call, and the other one, and this one, and that one, and then we have to give it to you intravenously. I said, but it's critically low. So I had my wife sneak me some Tums also. So I had Sweetamine and Tums, but I would say other than that, I would say it didn't really break the fast, because I was really fasting. I think in every other way, I think I had the benefits. It was not by choice, it was by necessity at that time, but I think it was good for me, because I would say it was really a 4 day fast.
I love that. And I guess it depends on why you're fasting too. If you're fasting to kind of lose weight, or, there might be actually metabolic benefits, where if you're fasting to detoxify, or because the doctor said,
Right.
That's different. Or, and I'm wondering, do you know if there's an insulin response to glycine, given that it's has that sweet taste, or would there not be? Because
I think so. I don't think there's any response. I haven't seen any evidence that there's an insulin response to it. No, I mean there is a response in terms of insulin sensitivity.
Right, a
Once
good
it goes down,
response.
blood sugar
Yeah.
will go down because it will actually lower diabetes. I would say that glycine supplement. I eventually got diabetes after about 15 years because my blood sugar was sort of chronically what they call impaired glucose tolerance. I have a history of diabetes, family history of diabetes. I was in impaired glucose tolerance territory. That was just starting to trip into diabetes in 2007, and at that time my boss, who was also my physician, because he ran a research foundation that I ran the lab in, and he said, I really ought to talk to you about using metformin, taking some medication for it. And I said, no, I'll just modify it by diet. And what I did was, that's when I started getting on the glycine. When I discovered all this about glycine and started supplementing with it in about 2008. So from 2008 to about 24, about 16 years, I was back to impaired glucose tolerance, fasting glucose of like between 105 and 120, somewhere in there, where 125 is diabetic. So then finally I started being diabetic, went up to 127, and then my GP said, you're really diabetic, you should take metformin. So I took metformin for it, but before I did that, I also lost 20 pounds. And losing 20 pounds, I went back to impaired glucose tolerance, but I've also been reading over the years that metformin is a very, very good drug. It's actually, it's called a biguanide. It's a naturally occurring kind of chemical that is naturally found in lilacs, apparently.
Oh, interesting.
Metformin, and it seems to be a very good drug. It seems to be like an anti-cancer drug, and as in addition to being an anti-diabetic drug and a good weight loss adjuvant, and just good for a lot of things. So that's becoming a new wonder drug. More and more, I think you're going to see that metformin is touted. Just something that's really good and a very mild drug. Again, I think. They probably make it synthetically, but you can have natural metformin of botanical origin. So.
Interesting. Yeah, my father's girlfriend was a physician, and that was one drug she was very holistically inclined, but metformin was one of the ones she
Yeah,
highly,
yeah,
highly
but
inclined.
something different from statins, which statins became kind
Yes,
of a wonder drug kind of thing, but
right.
I call statins mild chemo.
And what? You must. Okay,
Mild chemo.
stand up.
They basically, what's a chemotherapeutic agent is something that's a poison, and you're hopefully selectively poisoning cancer cells. And it's a mild chemo. It can help with cancer, for example, but
Interesting.
it poisons your liver. So statin, my LDL cholesterol was high, so my GP put me on a statin. He put me on like Lipitor because my LDL was about 130, 125, 130. It's not supposed to be over 100. So when I took the statin, it lowered it down to 75, and then I cut that dose in half from 20 milligrams to 10. It went up to about 100, just about normal. And then I decided not to do it because I was noticing my blood tests, my liver functions are a little bit high in the normal range. Oh, no, they're a little abnormal. No, they're a little bit more abnormal. I thought, you know what? Let me stop taking the statin. And guess what? My liver functions are beautiful now. So I think it's because it does poison the liver. The liver is the main source of cholesterol, and it's deliberately there to poison the enzyme, the key enzyme in the manufacture of cholesterol. The trouble with it, and the reason why it has other ill effects like in muscle weakness and pain and what they call myalgias, is that there's only one enzyme. For many things in the body, there are lots of different varieties of the same enzyme that will do the same thing, but they're a little different. And you can make an inhibitor, for example, that will target it in one organ and not another. But there is no such thing as any statin that will just target the liver, because every cell can make its own cholesterol. And so every cell is poisoned by it. Because cholesterol is a key ingredient in cell membranes. Your cells need lots of cholesterol. They make it all the time. The liver makes it. The liver is a way to get it to the body so they don't have to expend the metabolic energy to make it themselves. But most cells, just about all cells, can make cholesterol from scratch. And they can't, if they have statins, then it's going to be inhibiting their ability to make cholesterol as well as the liver. So it's sort of a generalized poison.
Fascinating.
It's really non-selective, I might have still taken it, say, oh, well, it's anti-cancer, it lowers your risk of this or that. But, and I'm 75, so. But then when I saw that it's, I really think I need my liver to
Yeah.
be in good shape. So I like the fact that it's all my organs are working normally across the board, so
Well,
I'd rather keep it that way. Yeah.
I'm glad you made that decision. Okay, two more quick questions. The last one is, can kids, teens, and pets take glycine? And then someone also asked, I have a glycine for pets. I think this was in another country. Can I take that one?
A glycine for pets? What do they mean?
So can kids, teens, and pets take
Oh,
glycine?
sure, yeah, everybody can. I would just say use proportional amounts. So if you have a dog that weighs 40 pounds, give it about, a quarter of a packet a day instead of a whole one, maybe 2 grams of glycine.
2 grams.
You
Okay.
sprinkle it in the bowl, they'll love it because it's sweet, so they'll lap it right up. So I would pose a question also in relation to that, and that is, why do you think dogs crave bones?
Glycine. Yeah.
Yes, they crave
Yeah.
bones because that's a source of glycine, and glycine it's hard to get because if you're a carnivore, it's easy to eat the muscle meats and the organ meats and all of that, but it's not so easy to eat the bones. You got to chew on them for hours and hours and hours, and dogs love to do that.
Yes, they do. And what about kids and teens? Any?
No, kids and teens. No, there's kids. Again, I would be proportional to body weight for kids. So, if a kid weighs 60 or 70 pounds, give them half a packet a day.
Okay, 4 grams.
It's just to make it about the same. But and you figure teens might need more of just about everything because their metabolism is going like crazy. But it's certainly not going to hurt. Yeah, it's safe for everybody, except with the exception of of various certain metabolic defects. If you have those or drugs that you're taking, in which case if you have a metabolic defect and you're probably working with a physician about it. Sometimes it's just a matter of educating your physician, or if you're watching or a physician and you're treating people like that and you want to learn more about it. That's a lot of people who watch these programs are like that. Physicians, chiropractors, other medical practitioners who can get better information sometimes rather than just going through the medical literature, which has all kinds of biases when it comes to something like glycine. It's the bias of it can't make me any money.
Yeah, primarily. Yeah.
Yeah, so it's yeah.
The last question is, and this feeds right into you telling us about sweetamine, is Glynac, glutathione, even magnesium glycinate, are these as good as taking glycine?
Or they're different. Well, Glynac is, again, it's glycine and it's N-acetylcysteine. And the theory behind that is that you need both of those in order to make glutathione. I think glutathione is overrated. It's the body's main antioxidant molecule that it makes. And supplements of glutathione have been found to be very beneficial. But remember, glutathione has just about the same glycine content as collagen. 1 out of 3 amino acids in collagen, 1 out of the 3 amino acids in glutathione is glycine. So I would say a lot of the benefits of people who take gram quantities of glutathione is they get the benefit of glycine. The other thing as far as Glynac is, is that cysteine, it's very hard to imagine that people are deficient in cysteine because muscle meats are rich in sulfur-containing amino acids, methionine and cysteine, which your body can also make from methionine. So it's hard to imagine a situation where people are deficient in cysteine, except if you take a lot of Tylenol, or generic Tylenol, or what's so-called paracetamol, or what's the generic name for Tylenol? Acetaminophen.
There you
So
go.
acetaminophen does directly poison glutathione by poisoning the cysteine part of it. So you can be made deficient in cysteine by taking things like Tylenol, acetaminophen. So I would say if acetaminophen is something that works for you as a good analgesic that you need to take from time to time, take Glynac with it. But in terms of a daily supplement, unless you take Tylenol or something like it as a daily medication, I wouldn't think you'd need it. You really need the glycine because you're probably not deficient in cysteine. The other thing, you talked about magnesium glycinate. Because there's a lot of talk about needing magnesium, and they say, oh, magnesium glycinate is the most absorbable form, and it's great for you, and it does this and it does that. Remember that magnesium glycinate is actually 86% glycine. And so it's when you take take these 2 big tablets to get you 300 milligrams, the recommended daily allowance of magnesium, that actually gives you 2 grams of glycine, which is a lot. That's a quarter pack of sweetamine. So that's a lot. And the same thing now, I've been hearing people talk about copper deficiency, that a lot of people are deficient now in copper. And that may be true. I'm not deficient in copper, I'm sure, because I drink all my water, and the stuff used in cooking and stuff comes through copper pipes.
Yeah.
These days, it comes largely through plastic pipes, so it doesn't have any copper in it. So, and copper is one of those micronutrients that you really need very little of, not a lot. Too much can lead to copper toxicity. But they say the best way to get copper is to use copper glycinate. Well, copper glycinate is 70% glycine. So a lot of these supplements, if you find, oh, this is great, it's really doing me well, you might take a look at what you're actually taking. You know, like SAMe, S-adenosylmethionine, has very little methionine in it, right?
Yeah.
Magnesium glycinate has very little methionine in it. You know, it's mostly something else. But that's, again, you know, a little bit of chemistry, so I'm just trying to give you the benefit of that basic information.
Perfect. And yeah, last episode, I said magnesium glycinate is primarily a magnesium supplement. And what I meant by that is it's going to fill your magnesium gap probably, but not necessarily your glycine gap.
Right, because your daily requirement for magnesium is 300 milligrams, not 8,000 milligrams.
Exactly. That's what I was saying. People are saying, but it's primarily glycinate. Yes, it is, but it won't fill that gap necessarily, according to Dr. Brind's research. So thank you, Dr. Brind.
You know what I like to say, the best way to fill the gap with magnesium. Because if you don't have magnesium, what do they say? You feel tired, right? Fatigued and all of that is one of the signs that you're deficient in magnesium. Well, my old school, my generation, not yours, we used to watch Popeye the Sailor Man on TV, you know.
Yes.
And Popeye, you know, when his girlfriend got in trouble, you know, the big bully,
Olive,
try to beat him up, Brutus, right? What would Popeye do? The music would come on and play, and Popeye would grab that 12-ounce can of spinach and chug-a-lug the spinach. And guess what that 12-ounce can of spinach has? 300 milligrams of magnesium. That's the best natural source. And what you should know about magnesium is it's a lot like iron in the sense that chemically speaking, in exactly the same way that iron is the element that turns blood red and red meat red. That's what makes blood red, is iron. Well, it's magnesium that makes green plants green. So if you're eating any kind of green vegetable, and blue cheese is not a green vegetable, but if you're eating any kind of green vegetable, you're getting magnesium, and spinach is probably the richest source. So the old Popeye the Sailor Man, pop a 12-ounce can of spinach every day, and you got all the magnesium you need. Sometimes there's wisdom in those old pop culture sources.
I love it. Well, Dr. Brind, this has been amazing. Tell everyone where they can connect with you and maybe how you use sweetamine on a daily basis. Everybody knows, I think that's listening, I like to fill my glycine gap with bone broth, but I also love your supplement for those people who want it a one and done, right? Hey everyone, before we jump into exactly how you can fill that glycine gap, for anyone who's new to the topic, I just want to give you a little very important backstory. And that is that Dr. Brind has been studying glycine for over 30 years. And I believe that he has come to a breakthrough revelation, and that is that most of us are deficient in glycine because we're only eating 2 to 3 grams because we're throwing bones and the connective tissue away and just eating muscle meat. And eating too much muscle meat can further deplete our glycine. But that we need 8 to 10 grams every single day in order to reap maximal benefits from glycine. The other finding is, though we hear in the mainstream that glycine is good for sleep, glycine has a maybe even more important benefit, and that is when it's in high enough amounts, which most of us are not consuming today, it can actually stabilize our immune cells and prevent unnecessary inflammation. In fact, Dr. Brind says that it's like a trigger lock for our macrophages and also prevents more explosive types of inflammation like pyroptosis. In other words, it is the alpha and omega of inflammation, in addition to being great for anti-aging, for being a calming neurotransmitter, and the production of bile salts, the production of glutathione and creatine, and of course, it is a building block of collagen. So if you want that healthy looking hair, skin, and nails, glycine is absolutely essential. And so I just wanted to make that clear that the big finding, the thing I'm trying to help people understand, is that we almost all of us need more glycine. And because 60% of diseases today are linked to this chronic low-level inflammation, and Dr. Brind believes that inflammation is not necessarily a normal response to injury, and that we could potentially turn a lot of this inflammation off with just getting enough glycine. Also, if you guys have any more burning questions about glycine, please let me know in the comments below and we'll do a second episode. Thanks for watching.
Right, one and done. Yeah, just you can put it in your coffee, use it like a sweetener, your coffee, your tea, anything you like sweet. What I like to do is I make lemonade with it. The first thing in the morning, it's good to clearing out the GI tract is to start every morning. The first thing I eat, 1 whole lemon's worth of lemon juice. Oh, wow. How do you eat that? With sweetamine, that's how. Take that lemon juice, squeeze it into a glass. You get about an ounce, ounce and a half of lemon juice. Add another 3 or 4 ounces, 2 or 3 ounces really, of water, right? So cut it about 1 to 3 with water to make lemonade, but then sweeten it with a whole packet of sweetamine. And it's very strong lemon taste, but sweet and I think delicious. So you can try it that way. You can try Dr. Brind's lemonade.
I hope you do.
Right. 1 lemon, a volume from juice of 1 lemon, 2 volumes of water, and 1 packet of sweetamine. It will mix at room temperature, but it takes a bit of mixing.
Yeah, thank you. These are always marathon discussions of ours, but people love it. So thank you, Dr. Brind.
Okay. Till next time, okay?
Okay.
All right. See you. Take care.